There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, is a blood pressure of 130/100 okay for a 32-year-old adult? Answer by Paul Wilson. With all these answers, there are all kinds of tips and good advice. The problem is that in 2011 the American Heart Association, AHA, lowered the blood pressure standards after years of it being at 140/90. They withdrew this edict and went back to 140/90. Then in November of 2017 the AHA came back and said, look, we have done 6 more years of research, and we have to lower the standards like we did previously. Now you are expected to have blood pressure of around 120/70 as a normal. Let's remember the previous respondent mentioned that one blood pressure reading is not sufficient for saying you have high blood pressure. The very way we measure blood pressure is an indirect measurement that is subject to many factors, particularly if we are using the manual method of blood pressure measurement. Even what you want the pressure to be can influence the reading during the manual blood pressure reading. Only an arterial measurement of blood pressure is accurate. Yet this requires a needle directly into an artery, and expensive equipment to measure that pressure directly. So logging it during various times of the day, and over the course of say 5 days to a week will give a medical professional a better appreciation for your real blood pressure average, and how you need to accommodate a blood pressure control program. Remember, high blood pressure is called the silent killer. Long-term high blood pressure will eventually destroy your kidneys, and enlarge your heart. Both have currently no cure, only control. Both have no symptoms, therefore they are silent. Blood pressure control is the key to this problem, which is often hereditary. Knowing your parents' medical history can help predict your own. Answer by Scarlett DeLion. Question, is a blood pressure of 130/100 okay for a 32-year-old adult? Many eons ago, when my father had a Wisconsin EMT number that matched with a valid and current license, a normal blood pressure was 100 plus age, up to 150, for the top number in men. For women it was 90 plus age, up to 140. Nowadays, that top number is high. But that bottom number, you might want to go be seen by your doctor relatively soonish. Answer by Julia Markov. T blood pressure iron elevated, LTH bottom number. However, WBNT make a diagnosis of high blood pressure with just one reading. If it remains elevated, above 90, and future readings TH and THR are a number of lifestyle modifications you and may come Mr. aerobic exercise, optimal diet with LW salt, ND weight loss. If THT didn't work UMND medication. High blood pressure or hypertension has become a global concern, considering the sedentary lifestyles we live in. The amount of stress we take has taken a toll on our body. There is very simple concept with unbelievable therapy to control high blood pressure, given it control your blood pressure. A lot of patients use this strategy and got rid of hypertension.